So if we're trying to identify patients for a clinical trial or for another use case using billing codes, that term billing codes probably means standardized code systems that would show up in billing records. Another way to think about that might be this is the least information dense record from a clinical perspective about the patient, right? These billing data sets are designed for billing. They're not designed to reflect the patient's clinical reality except to the extent that impacts the billing. So within those systems, we may be able to learn a lot about patients, but we won't have the precision that would be available if we could see clinical terminology for those patients as well. I'll give an example of this. This comes up in rare disease quite often, where the coding that gets used, things like ICD-10 diagnosis coding, to plug into billing systems just doesn't have the degree of specificity that is needed to reflect particular kinds of patient populations or subpopulations. So within that condition area of rare disease, for example, there's a condition called myasthenia gravis. There's an ICD-10 code for it. You can find patients with that code in billing code sets. But if you wanted to look for patients who are only specifically experiencing ocular myasthenia gravis, the form of the disease that predominantly or exclusively affects the eye, there's no ICD-10 code. And so you don't have a way of looking for such a patient in a claims or billing data set. Now you can do things like say, if they have the general disease code and they've seen an ophthalmologist, maybe, does that get me where I need to be? It can give you some information. In practice, it can be hard to act on that for something like clinical trial recruitment or trying to get patients access to a therapy. If you use clinical terminology, like IMO Health terminology, we can just distinguish patients with ocular myasthenia gravis. And we can say at the point of care, here's somebody who the physician is reporting to have that specific expression of the disease. And now if we're in a trial where we want to find patients who are eligible based on that context, or we have some sort of treatment that's only appropriate for those patients, we can use that specificity to help get closer to that individual.